As of July 1st, 2020, the Covid-19 figures stood at 10,694,288 confirmed cases worldwide, with 516,210 deaths since the start of the pandemic. Moreover, these huge figures are expected to go higher in the coming days. The African continent, apparently less affected than the rest of the world, is also facing the spread of the Covid-19, with all of its 54 countries affected. As of the 1st of July, 10,406 deaths were reported in Africa, with about 198,193 recoveries, for an overall of 418,288 cases registered, according to the World Health Organization. In addition to that, there are increasing indications that this balance sheet is greatly underestimated. Southern Africa is the most affected area on the continent in terms of COVID-19 positive cases, surpassing Northern Africa. West Africa is the third most affected region of the continent in number of cases.
Nous avons atteint la barre des 100 000 personnes affectées.
We reached the number of 100,000 people affected in the region, but the good news is that more than half of this number have recovered from the COVID-19. Moreover, these figures are much lower than what we predicted. The death toll of around 2% is rather low compared to what was expected. In addition to that, the progression of the pandemic is very slow in comparison with the initial tendencies observed at the beginning of the COVID-19. Globally speaking, the cartography of the pandemic in the region is clustered. There are some countries where the expansion is faster than in others, added to the factor that the mortality rate varies according to the country. Responses are also different from a country to another.
Qualité de réponse différente d'un pays à l'autre.
Au Sénégal, actuellement, nous sommes quand même dans une phase de transmission active.
In Senegal, we are in an active transmission phase of the pandemic as we are now beyond 6,000 cases since the beginning. The first case was notified on March 2nd, 2020, with 105 people dead from the COVID-19, a reasonable number of 1.6% rate, I'll say, with more than 65% of recoveries, which is globally encouraging as it motivates the health personnel. However, we have noticed an increase of the cases over the past 2 months. That's why we are now exploring the reasons in order to stem the trend. In addition to that, we are far from the initial previsions, which spoke about 15,000 cases for Senegal, and after 4 months of the pandemic, we are only at 1/3 of these previsions. This means that efforts are being made, and the government of Senegal, through the Ministry in charge of Health, are doing their best to mitigate this pandemic in Senegal.
With a great concern about the rapid spread of the virus in the region, the United Nations Population Fund, UNFPA, has responded in the most appropriate way to the pandemic by finding an answer to the challenges. In so doing, the regional office of the UNFPA in West and Central Africa, covering 23 countries, all of which are affected by the pandemic, decided to support the response plans of the governments, all the more since the region has the most vulnerable health systems.
Ce que nous faisons, donc de façon générale, c'est que nous renforçons les systèmes de santé.
What we do in general is reinforcing the health systems, which constitute the core of the answer to the COVID-19. Therefore, we intervene in all levels of the global health disposals in the country where we are. We also pay particular attention to all services in relation to women, girls, children and youth. That's why we are supporting services working on maternal health, and we mobilize the youth, who represent the symbol of the answer, mainly in countries where the health centers don't have enough personnel. Because youth constitute an important resource for preventing, testing and tracking, and even in raising awareness in the community level. That's why we have much invested in preventing these types of violence, as well as taking care of those who are victims of this violence.
Mais nous travaillons également dans le domaine un peu du relèvement, donc socio-économique, comme vous le savez, le confinement. Donc
we also work on the social support level. As you know, the lockdown and the response policies have created new conditions unknown hitherto. We didn't want to wait until the end of the pandemic to start fighting against the side effects created by the Covid-19. To sum it up, we work on all aspects of the chain by providing technical and material support, as well as a social and psychological relief regarding the most vulnerable populations.
Every day around the world, almost 500 women and adolescent girls die of complications related to their pregnancy or childbirth with precarious emergency situations. Factors like the acuity of the COVID-19, the lack of information, the stigma or the fear of being infected and so on have generated negative consequences in the fight. In some cases, the continuity of integrated sexual and reproductive health services is interrupted, which has drastic effects on women.
Pregnancies don't stop for the pandemic. Sexual and reproductive health services are not just nice to have, they are essential. Even before the emergence of COVID-19 for millions of women, timely, high-quality maternal health care was unavailable, it was inaccessible, or it was not affordable. And now, with the pandemic, we're seeing exacerbation of already limited access to care, putting women's health and lives at risk. With COVID-19 affecting health systems, many pregnant women are being cut off from reproductive health care. Many thousands could die from preventable complications of pregnancy and childbirth.
Nous avons vraiment la majorité de nos patients entre 20 et 40 ans.
Most of our patients are between 20 and 40 years old, and the proportion of children from 0 to 11 is at 7%, but hopefully there is no death recorded at this average age. We also got 2 cesareans in our health structures, one in Dakar and another in the Kolda region. Indeed, we have pregnant women tested positive to the COVID-19. But another remark is the decrease of visits in our health structures. If you take the pediatric services, we have recorded a decrease at 80%, which is a real concern. There is also a decrease in the vaccination programs, and some cases of home deliveries have sprouted with some restriction measures because of the curfew from 11 p.m. to 5 a.m. So, of course, there is an impact on vulnerable populations, and we are trying to protect them. Strategies are being deployed, such as going towards these children's parents for the vaccination, as well as providing healthcare services to these pregnant women and urging them to join health services.
Aller vers ces enfants, donc augmenter les taux de vaccination, mais également donner des services à ces femmes enceintes afin qu'elles puissent rejoindre les services de santé.
The UNFPA Regional Office commitment with governments and partners is motivated by the importance of taking charge of reproductive health policies. The objective is to prioritise taking care of the specific needs of women and girls. It is about ending unmet needs for family planning, preventable maternal mortality, and gender-based violence and harmful practices by 2030. The fund has supported governments in ensuring continuity in the quality of reproductive, maternal, newborn, child and adolescent health services. In all countries of the region, the United Nations Population Fund has indeed helped strengthen health systems, including emergency obstetric care, routine prenatal and postnatal care, as well as family planning services and gender-based violence. When they took me to the treatment centre on April 15th, my greatest fear was the child I'm pregnant of. Knowing that the baby had been very active within my womb, there was a moment I didn't feel his movements anymore. There was no gynecologist or obstetrician to check my health state. I don't feel at ease here because people only pass around and look at you in a strange way. They even call it the Corona House, and sometimes you can see people running away because they are fearing to get in touch with us.
Le Fonds des Nations Unies pour la population est une agence des Nations Unies.
The UNFPA is a United Nations fund whose objective is to support governments in their policies in emergency situations.
Donc, il y a plusieurs aspects qui ont été pris en compte. C'est le volet coordination, mais aussi le volet renforcement des capacités, le volet équipement.
In so doing, many aspects have been taken into account, such as the coordination, capacity building, protection equipment and medicines for the health personnel, as well as for the community mobilisation and knowledge management. This support was materialised by financial fundraising, as well as a technical support, which allowed the UNFPA to back Senegal in its reference document for the fight against the pandemic and the continuity of services.
Aussi bien contre la Covid-19 que dans la continuité des services.
Ce que nous avons fait dans cette démarche en tant qu'agence des Nations Unies, c'est de veiller.
What we did as a UN agency is to use a holistic approach by involving everybody, including the most vulnerable populations, those living with a handicap, and all those affected by the Covid-19 pandemic. I'd like also to add that the UNFPA worked with the government via the ministries in charge of health, in charge of the youth, social action, but also the Ministry of Justice for the advocacies, the Ministry of Islamic Affairs. The latter have been very active in raising awareness as well as implementing initiatives towards the populations.
Des cibles de plaidoyer, mais aussi des cibles d'action concrète sur le terrain.
By implementing its readiness and response plan, UNFPA capitalised on its experience thanks to the interventions in the response to the Ebola virus. That experience allowed the organisation to contain and mitigate the impact of the COVID-19 on young people and women, especially pregnant women. The Ebola pandemic broke out in southern Guinea in December 2013 and spread to Liberia and Sierra Leone, the three most affected West African countries, before extending to Nigeria and Mali. In 2 years, 10 countries were officially affected. Also, 11,315 deaths were reported out of 28,637 cases. This assessment, which has been undervalued according to the World Health Organization, is higher than all the overall figures from Ebola epidemics reported since the identification of the virus in Central Africa in 1976. At that time, the UNFPA Regional Office worked with populations in order to facilitate screening, contact tracing and restoration of essential services to survival. And the focus on maternal health through a regional approach had saved the lives of at least 1,000 women, girls and children in the three most affected countries.
UNFPA supported the three Mano River countries, Guinea, Sierra Leone and Liberia, during the Ebola crisis to support epidemiological surveillance, especially contact tracing. So what happened as soon as there was a first case recorded here, we went into action and provided support to the Ministry of Health and the National Public Health Institute of Liberia in the area of contact tracing and epi-surveillance. We trained the first contact tracers. We provided resources. We provided vehicles, 4 motorcycles, 5 cars, and mobile phones to help in data collection. So when we recruited and trained these contact tracers, they were deployed to support the contact tracing. And they have been doing that. We were able to even pay allowances for the contact tracers until the end of May. So that was the first aspect. The second one is in the area of maternal health, care of pregnant women who are infected with. Access to maternal health services has gone down. And so we have also sprung into action. We have put in place a team of roving midwives who are supporting pregnant women who are infected with COVID-19. Again, we have also set up outreach activities that go into the communities because the women are not coming to the hospitals as they used to. So these teams go out to the communities and provide family planning services, and then they also follow up and provide antenatal care. And then they also go to the treatment centers and help in taking care of pregnant women who are infected with.
Thanks to this experience, the United Nations agencies in West and Central Africa have intensified their support to governments in order to prepare and adequately respond to the growing number of cases linked to the COVID-19 pandemic in the region.
La situation risque d'être très très grave donc pour les pays.
The situation may get worse in countries with weak health infrastructures. That's why we decided to invest in the community response right at the beginning.
Et c'est d'ailleurs ce même constat ou peut-être cette leçon que nous avons tirée de l'expérience Ebola qui nous a dit, écoutez, il faut également mobiliser.
Thanks to our experience we got from the Ebola pandemic, we decided to mobilize all the youth who were at the center of our action against Ebola in the Mano River states. We also noticed that during the Ebola outbreak, there was a lack of confidence between the health personnel and the public.
Le secteur de la santé donc, et le public, parce que le public ne faisait pas confiance au secteur de la santé. Et même
in addition to that, when the few of them who could feel confident with the health structures went to hospitals, the personnel could happen to be doubtful in getting in contact with these potential patients. At that time, in the Mano River countries, some women could even delve on the floor because of the situation. That's why we said at a certain moment that we couldn't see this kind of tragedy anymore in the region. This urged us to reinforce the health services to avoid the lack of confidence among protagonists.
En tout cas, de créer une situation de manque de confiance.
As soon as the first cases of COVID-19 appeared, the UNFPA offices at the country level provided support for the coordination and surveillance of cases. They also contributed to the strengthening of health providers and community workers' capacities by providing vital medicines for mothers, children, adolescents and so on. Also, they provided personal protective equipment and products and an endless support to the community mobilization. During the first phase, when the government initiated the lockdown, the advanced and mobile strategies also stopped at the same time. The UNFPA supports some regions considered as problematic in terms of means availability, such as Kolda, Ziguinchor, Tambacounda and Kédougou. This aid is made via some NGOs which are present in the region, mainly the rural areas where family planning and reproductive health services are provided. Other targets such as youth health, the fight against HIV and STDs are also included in the support. Knowing that Senegal was in a curfew period, all these activities stopped. So this means there's a coverage problem which occurs regarding service delivery. In addition to that, even in the existing public health centres, population's visits have drastically decreased because of the pandemic.
Ils ont limité un peu leur fréquentation par rapport à la santé de la reproduction.
Il faut convenir que l'impact de la Covid sur la santé de la reproduction.
Indeed, there is a direct impact of the COVID-19 over reproductive health services, as it has restricted, in one way or another, their access to these services. And we need to address these impacts insofar as the different restriction measures which have been taken would have a considerable impact on policies being carried out. Therefore, measures and initiatives to bring solutions should be found in order to guarantee the access to reproductive health services. That's why we spoke about continuum regarding these services. Hopefully, the Ministry in charge of health is daily devoted to that cause with the support of partners like the UNFPA. Besides, in collaboration with the Ministry of Health, we have taken initiatives to make available all services required during deliveries or other products needed for family planning, such as contraceptive products. This by avoiding any shortage in the central, regional and local levels.
Because we had experience in doing contact tracing, in supporting epi surveillance, we were able to quickly use our experience. We were able to use a tool called Kobo Collect, which was installed on phones. We were able to train people. So really the experience in doing contact tracing for Ebola came in handy for UNFPA to support the country. Obviously, the other issue we learned a lesson was that during the Ebola, many women could not access the health facilities. So this also encouraged us to quickly move in, have midwives trained, set up a maternity center. So that experience came in handy and has been able to allow UNFPA to respond quickly in supporting the government.
In Togo, in order to contribute to reducing the spread of the virus, the Association of Volunteers for the Promotion of Young People made its mobile application called E-Friendly Center accessible to the populations with the support of the UNFPA.
We specially developed a model called Covid-19 with doctors and midwives supplying information to the populations. And with the application E-Friendly Center, with the Covid-19 module, the user has the possibility to see the preventive methods. But one of the core modules of the application is the online assistance, which is an instantaneous messaging option managed by tele-advisors and health professionals.
In Benin, the UNFPA collaborated with startups. They together implemented innovative solutions to inform populations, even in the most remote areas, to fight against fake news. It also enabled medical staff to have access to efficient and rapid methods for experiences and good practices exchange. The same efforts are reported in Burkina Faso, where the UNFPA country office participates in the joint effort of the United Nations system in collaboration with the government, within the One System framework, which brings together all the United Nations agencies. Several measures have been taken, including the provision of protection kits for health workers, but also the setup of an information platform on COVID-19 for young people. I think it's a very dynamic program which has demonstrated its importance right at the beginning of the pandemic. Personally, this is the first time we're working with the National Volunteers Programme, and it's globally satisfactory. We're on duty for 1 month, renewable depending on the evolution of the pandemic, and according to me, that's a very good initiative in mobilising youths in civic actions at the service of populations. According to the United Nations Fund for Population, it would take $187,500,000 to strengthen public health systems. The UNFPA thus calls on all donors to contribute to financing the government's response to the COVID-19 pandemic.